WGST. Welcome back. And if you're just tuning in, you're listening to Health Tech Talk, broadcasting from iHeartRadio, 640 WGST, and also streaming worldwide on the iHeartRadio network. With me is my next guest, Dr. Jose Bareau. He is the co-founder and CEO of Hallo, a really amazing company, and he's also broadcasting us. He was from HIMSS. He was at HIMSS this week, like our previous two guests. Doc, welcome to the show. I'm going to tell the audience a little about your company, but also I would love if you told me our audience, a little bit about your background, and then we're going to jump into Hallo.
Sure. Thanks, Ben. I appreciate you having us on. I am a physician by trade. I'm a medical oncologist. And 5 years ago, I was director of a cancer institute, and I saw that communication was a big problem, particularly between physicians. And a colleague of mine, we decided to jump in the technology world and start, trying to figure out better ways for physicians to communicate.
So that's awesome. So you decided to jump into the business world. So what is Hallo all about? Describe the company.
So really, Hallo is all about mobile health. And our product is a mobile health platform, and it's built on really three pillars. Number one is secure communication, so secure texting for physicians, nurses, and all healthcare staff. The second pillar is enterprise integration, so making our mobile apps work with existing electronic health records, operator consoles, clinical alarms. And the third pillar is just clinical innovation, creating innovative products for physicians and putting them inside of mobile apps so they can use them to take care of patients.
So Doc, do physicians want this? I mean, you're a physician. Was it something you were looking for, and that's why you created the company?
Ben, absolutely. At the time, it was really tough getting in touch with physicians and getting in touch with your nurse even with outdated technologies, things like pagers. They interrupt you, and you don't know what the message is about. So there was a big demand from our physicians to carry one device, and smartphones are everywhere. I mean, 90% of physicians carry a smartphone. Even the older physicians are carrying smartphones. So it was time, and the mobile health revolution is happening currently. And if at HIMSS here in Chicago, we're seeing really interesting, innovative mobile products for physicians.
So the time is now, right? So we're here. It's not just talk.
Absolutely. The time is now. It was when we started this company 5 years ago, it was talk, and it was hype. And there was a lot of things saying that we could do and what we tried to do. But now it's a different time. The phones really are everywhere. The technology is there. I mean, you're creating enterprise-level apps for Apple and Android. So, absolutely, the time is now. Physicians want it, and you can see it. HIMSS has a whole knowledge center dedicated to mobile health, and there's just a lot of activity.
So, Doc, for my audience at home so they understand, how, in the simplest way you can, describe how Hallo works on two sides, for the physician but also for their patient.
So for a physician, instead of carrying, let's say, a pager or some other device, what they do is every communication comes to them on this mobile app on their Apple or Android device. So after-hours calls from nurses in the hospital, from their nurses in their offices, even from patients. Doctors use mobole apps to connect with patients. So all of their communication is on one mobile app and secure. That's the other big thing. Texting, normal SMS isn't secure. This is all encrypted and meets HIPAA standards. The other aspect is being able to pull up relevant patient information. If I want a laboratory result, if I want to see an X-ray, you can pull it up right on your mobile app. And we know doctors are running around all the time. They're not sedentary individuals, and their job is always on the go and they're on their feet. So being able to really pull up relevant clinical information right from your mobile app and take care of patients right there is really what the mobile health platform and really Hallo is all about.
And on the patient side, how does that work?
So patients more and more, they want real-time information. They want to talk to their offices and their physicians. And physicians more and more are feeling comfortable with the idea of text messaging their patients. But they can't do it on a normal phone through a normal line. It's just not secure. So Hallo allows the ability of patients to download the app and have a secure communication with their physician and also pull up relevant data that the physician may want them to have. along with educational material that the physician may want them to have. So their mobile app can be their small health repository to communicate with their healthcare providers and look at data that the physician may want them to see.
So it's not a one-way street, right? It's a two-way street. It's not only the doc giving me information or after he sends me home giving me education or, information to follow, but it's also me as the patient. Do I get to interact directly with my physician?
Absolutely. It's definitely not a one-way street. It's all about a two-way street. It's all about efficient two-way communication. And being able to ask your physician a quick question in a non-interruptive way, and even after hours. A lot of times patients after hours at 5 o'clock, they may not get their physician. They may call the office. That physician is gone. There's another physician who answers the call who's not familiar with that patient at all. So being able to communicate with your physician after hours, he knows you. He knows you very well. He knows what medications you're on. And that problem may have saved you an ER trip. If your doctor knows, hey, what you're talking about is not that serious, I know you have this, or I know what medications you're on. It just changes the game for the patient and gives them that 24/7 kind of communication with their physician.
Which is what I want in 2015. I want, as a parent and as a father, is if something's going on with one of my kids, I want to be able to talk to my physician. I want to be able to. So the question I got, is it just text information, or are you going down the road where I'm going to be able to send images of a sore or photos? Is it just me, interacting via text? Doc, are you there?
Yep, it is both ways. It is taking photos. It is showing a wound, showing a rash. Actually, pediatricians are very used to seeing a rash over a phone that their patient took. And it's also records, not only photo and video, but also records. And the ability to see a lab report that your doctor ordered early in the day, you being able to pull it up on your mobile app as a patient, and then asking your doctor a question about that laboratory. So it's two ways. It's video, it's photo, and it's actually laboratory data and some other things.
So in some ways, it's like it's elements of a virtual visit also, right? So it's about getting that information to my physician interacting with me, but it's staying in contact. It's making me as a patient feel reassured that I'm getting the best health care I can get.
Yeah, Ben, absolutely. And I know people talk a lot about telehealth. A lot of telehealth companies, you have video chat, but a lot of times that's not your physician. You're paying for a service, and you're video chatting with a physician who doesn't know you. What we're talking about here is extending that relationship with your current physician into your mobile device. So it's somebody who knows about you and knows your health history. So it really changes the dynamics of the relationship and just improves patient care. And Ben, as a patient, you would appreciate, this type of access to your physician.
Absolutely. So I got a question. So are you out there? Do you sell the service to physicians and institutions, or can the patient get involved too?
So we actually sell Doc Hallo to healthcare institutions. So we sell it to hospitals and hospital systems, and they implement this throughout their system. So first their physicians and their nurses get on, and other staff, and then after that we institute something called Patient Hallo. So Doc Hallo is for the physician staff and nurses, and then we release Patient Hallo into the environment surrounding that hospital. So we love the term Hallo because, in effect, it's a communication halo that extends outside the hospital to the office and outside into the community where the patients live. So,
if in your research and as you've rolled this out, what's like the number one feedback you get from physicians after they've been using it for a while?
Really, the number one feedback is just the efficiency and the time saved having to track people down. If I'm a cardiologist and I need to talk to a primary care doctor, I can just get them right now through a secure message. If I need to send him anything, it's right away. It's not calling his office. It's not waiting for him to call you back or sending him a page. So just the efficiency and the reduced time it takes to communicate in the healthcare landscape is just reduced incredibly.
So if I had you on the show in 2010 when you launched Doc Hallo, and I said, hey, make a prediction in 5 years, and I had you on the show, would your prediction of where the industry has gone? Is it faster or slower than you expected?
It's definitely slower. When we started, there was nobody searching for this at all. You got to remember, smartphones, Ben, were kind of introduced in reality, Apple, in 2007. So when we started in 2010, there weren't that many apps. Actually, Bank of America came out with an app for transferring money, and then we realized, hey, if Bank of America could come up with an app and they allow you to check for money, then we should be able to do this for healthcare, and you can do it securely, and build enterprise apps. So it's moved slower than we thought, but it's really taken off really in the last 12 months. It's really when you're seeing the mobile revolution. I
want to take that point to our next segment. I need to cut for a commercial. I want to thank 1-800 Public Relations for all their support, and Paul in the control room for all of his help to make me sound good. And for all of you listening, we'll be right back after these words from our sponsors.
This is Scott Vinson, and I have served 2 tours in the country of Afghanistan as an airborne infantryman. Now, I'm an independent sales associate affiliated with the Coldwell Banker brand. I've joined the iHeartRadio movement to support our country's veterans in building profitable and growth-oriented civilian careers. Coldwell Banker Real Estate recognizes and values what veterans have to offer. If you are interested in exploring your own next steps, then go to iHeartRadio.com/showyourstripes or coldwellbanker.com to learn more.
iHeartRadio.com/showyourstripes. Hire smart. Hire vets.
Hey, this is Mara Davis, and right here on 640 WGST, we talk food 11 to 12. Don't miss us every Saturday, 11 to 12 on 640 WGST.
iHeartRadio salutes Who Cares? Teen Cancer America, founded by Roger Daltrey and Pete Townsend of The Who. Roger Daltrey.
Teenagers love to be together. Remember the parties you used to have with all your mates? Teenagers with cancer want to do the same thing. They need a little bit of space in a hospital where they can be teenagers, make a bit of noise, they can have computers, they can continue their education.
Join Roger and Pete. Learn how you can help make life a little easier for teens battling cancer. Visit teencanceramerica.org.
When Jenny and I bought our home, we ignored our friend's advice. We didn't get a home warranty to help protect against expensive home appliance breakdowns.
It was Ken who ignored them.
I thought we'd risk it and cover the costs ourselves if something broke down.
Then our water heater died. Hundreds of dollars gone.
Yeah, well.
The next year, our refrigerator quit. Our washer needed repairs, and we had a plumbing nightmare.
Just bad luck.
But last summer, when our air conditioner packed it in...
I had to admit, enough was enough.
Oh, hallelujah.
Hallelujah indeed. Because when you get a home warranty from American Home Shield, they help pay your covered repair and replacement costs for you. So you get to protect more of your hard-earned money. Service requests are subject to a fee for each trade called. Some exclusions and limitations apply. Don't put it off any longer. Let American Home Shield help with your unexpected covered appliance repair and replacement costs. For valuable free information, call 1-800-500-5114. That's 1-800-500-5114. 1-800-500-5114.
You want to know a secret that Xfinity and the other cable and satellite TV companies don't want you to know? You don't have to pay for TV. That's right. TV is free, and it's always been free. All you need is a broadcast antenna, and bam! You can get over 80 channels in Atlanta. Channels like This TV and Moxie, with all movies all day on WANN TV 32 and WTBS TV 26, has extreme sports on Tough TV. There's so many channels to watch, and it's all free. So pick up a broadcast antenna and cut your cable bill today.
Hey, it's Kim with Superior Chevrolet. Do you know why customers from all over Atlanta, even as far out as Buford, come to Superior Chevrolet for their truck? It's because of our exclusive lifetime powertrain protection, which, by the way, no other dealer can offer. And it's no charge. Let me say that again. We're the only dealer to offer exclusive lifetime powertrain protection at no charge, which is a pretty good reason to stop in.
Superior Chevrolet.
Your dealership for life.
My wife and I just moved into our new home when wham, the refrigerator died. Then wham again, the air conditioner had a meltdown.
When moving into a new home, the last thing you need is an unexpected home system or appliance breakdown. It could cost you a fortune. That's why more and more home buyers are getting a home warranty from American Home Shield. A home warranty protects against those unexpected covered breakdowns, including your air conditioning, water heater, plumbing, refrigerator, washer, and much more. When it comes to selling a home warranty really can make or break the deal. For complimentary, helpful information, see your local real estate professional or call 1-800-700-5198. Service requests are subject to a fee for each trade call. Some exclusions and limitations apply. Home systems and appliances do break down. That's why a home warranty makes so much sense. And American Home Shield delivers award-winning service. For complimentary, helpful information, including terms, rates, and coverage, call American Home Shield, 1-800-700-5198. 1-800-700-5198.
This is an announcement for all people who want to take a risk-free challenge to whiten their teeth in 5 minutes using clinically proven power swabs. This risk-free challenge is for people whose smile has been yellowed by coffee, tea, or smoking. It's so effective, we challenge you to try it for 5 minutes to see how white your smile could be. If lines are busy, try again. Dial 1-800-663-5922. That's 1-800-663-5922. 1-800-663-5922.
The Glenn Beck Program, weekday mornings at 9:06 on Talk Radio 640 WGST.
Welcome back, and if you're just tuning in, you're listening to Health Tech Talk, broadcasting from iHeart Radio Studios, 640 WGST, and streaming worldwide on the iHeart Radio Network. I have the CEO and founder of a really, really cool company called Doc Hallo. He happens to be at HIMSS, this huge conference we've been talking about, the entire show going on in Chicago. That's all about healthcare. We talked a lot about his company in the first segment, but this segment I want to dig deeper. One of the interesting things that I read about your company is that unlike a lot of other companies that are playing in this space, you have a lot of physicians working on the tech. And on an outsider looking in, I think that's really important because one thing I know about healthcare is that doctors have a flow of how they like to treat patients. I'm not a doctor, so I can't answer that, but I'm going to throw that back to you, Doc. So how important is it when you were putting this company together and as you grow that you have physicians on staff helping with the development of technology?
You know, Ben, that's a great question. When we started this company in 2010, we realized that most of the technology that was created for doctors, electronic health records and those types of things, did not have deep physician involvement while it was being created. And therefore, physicians felt like it hurt their workflow versus helping it. So when we started our company, we thought it was really important to get doctors deeply involved in the development of the software. From day one, we brought physicians in, and not just as consultants and bystanders. We have physicians deeply involved, employed in the company, who sit side by side with engineers. And when they do their business specifications and they spec these projects out and these innovative features, the doctors are there the whole time, all the way giving their input. It's just so important to make sure that the products you develop have a lot of physician input from day one, or they're not going to be used. And, I think that, physicians may have a reputation of being sometimes finicky and sometimes not adapting to new technology, but that's because a lot of times it's not made with them in mind. So that is a big thing and a big driving force behind Doc Hallo.
So you created Doc Hallo with the physician in mind, but also usable for the patient.
Absolutely. Usable for the patient, but also the nurses. Team is a healthcare sport now, Ben, as you know. It's not just a physician walking around giving orders. It's a team. It's a physician. It's a nurse. It could be a caregiver, and it could be a physical therapist and a psychologist. So all, patients deserve a team. And so that's the whole thing of Doc Hallo, is that halo of communication around the entire team. And it has to be easy to use. Obviously, physicians do the most complicated functions with it, but it needs to be good for everyone.
So, Doc, how do people find out about Doc Hallo? Where can they go?
So I suppose the easiest way would be just to go to www.hallo.com and go on the website, and we have all types of information. We have organizations that are on Doc Hallo there, so you can kind of take a look at some of the larger, small organizations. And we have all kinds of demos that you can request, and you can see all types of innovative features that we're working on.
So I also noticed in reading your material, everything you do is Hipaa compliant. And so for our audience doesn't know what Hipaa means, can you tell our audience what Hipaa means and why is it so important?
So, with the news these days, everybody's sort of familiar with breach of data, getting your data out there and hackers being involved and being able to find out information about you. Well, healthcare data is very personal data to people, and it's just as important as your credit card number, your Social Security number. Your life can be affected if somebody knows personal healthcare information about you that really shouldn't be public. So HealthTech Act and HIPAA is, is intended for technology companies and providers and everyone to know how to handle this protected health information, know how to handle patients' information with the best practices, so that does not get leaked out and people maintain their privacy.
That is really cool. Another question I got for you, and I read this all through your website and the material that I read through, and I'm a big believer of patient engagement. But what really is patient engagement, and is it really important? And is it being driven by the patient? Is it being driven by the institution and the physician? Or is it being driven because now everyone's paying so high premiums that they really want to get engaged? Why is this a revolution all of a sudden called patient engagement?
You know, it's a revolution from every corner of healthcare. But, you know, the big reason patient engagement is so important because, you know, we started realizing that if patients aren't engaged in their care, if they're not educated and motivated to make themselves better, nobody's going to do it. No doctor can tell a patient what to do. You can tell them, but you can't make them do it. And patients need to be educated about their health. They need to be engaged in their health. It's a new era. You know, you need to ask your doctor questions, and your doctor should be able to communicate with you in a way that you understand what type of medical treatment you're receiving. And because if you understand what you're receiving and you understand what's going on, you become engaged. If you're a patient and you don't understand what your physician is saying, you don't understand why you're getting treated, you know, the natural reaction for anybody is to become disengaged and not think about it. You just can't understand it. So really it's about improving patient health that we know happens if the patient is engaged and understands the health care they're receiving.
So I'm gonna make another assumption. So as you're dealing with institutions and you're selling your services, are one of the keys besides the patient engagement, is it readmissions and adherence? Do you help meet those needs for institutions? And just for everyone listening knows, if you go see a doctor and you have a procedure done and they send you home and you come back in 30 days or less than 30 days, the hospital can be dinged. They can be fined. I look at a technology like Doc Hallo. Does it help with that element too? Reminding patients to take their medication, reminding them how to care for themselves when they go home. Is that part of the mix?
Absolutely, Ben. One of the biggest benefits of our system is our nurse navigator. So nurse navigators love Doc Hallo. They're the ones who take a patient's care over. When a patient gets discharged from the hospital, they have many things to do. As you know, they have to go to the pharmacy, pick up a prescription. They have to go and follow up an appointment with their doctor to ensure that whatever they were hospitalized for is now resolved. So a nurse navigator is a relatively new entrance into healthcare, but it's becoming very popular. For that nurse navigator to guide that patient to the pharmacy, make sure they took their medication, make sure they're doing okay, to keep them from having to come back to the emergency room for care. So that's the key. That's the whole thing of reducing readmissions. And if you're reducing readmission, that means you're improving health care.
That's incredible. So you meet both of that. All right, so I have like a minute and a half left with you before the show is over. This time has flown with you. It's been so much fun. Anything you want our audience to know, thinking that our audience is broken up in three audiences. It's a business show first and foremost. We have a lot of investors listening. We have a lot of healthcare professionals listening. And, of course, we have a lot of consumers listening. Any message you want to give them?
What I would just say is that technology is here for healthcare. There's still a lot of things that are not ready for prime time, so to speak. But mobile has arrived. And many things are being done now mobilely that couldn't be done 1 and 2 years ago. So the landscape is really changing. It's a really exciting time, for healthcare all the way around, especially in technology.
So when I get you back on the show in 5 years from now, what do you think we're going to be talking about?
That's a good question. We're rolling out our Apple Watch with our Doc Hallo app. And I think, we might be talking about some virtual patient encounters through holograms and things like that. I mean, I'm seeing technology right now emerging for virtual visits and telehealth that are amazing. So we're going to be moving healthcare to every corner of the United States, whether there's a doctor present or not. There will be a hologram or some type of healthcare being provided through technology.
Doc, I love having you on the show. I love Doc Hallo. Can't believe you waited till like 10 seconds left in the show to bring up the Apple Watch. We're going to get you back on to talk about that in detail soon. I want to thank everyone for listening